Hi, it's Amanda Cassar from Wealth Planning Partners and wanting to have a chat today about health insurance. Now, one of the first things to go when we find ourselves in financial difficulties is discretionary spending. And sometimes health insurance is the top of that list and one of the first things we want to get rid of, as it's quite a substantial spend each week, fortnight or month, depending on how you pay. So I wanted to run through the pros and cons of keeping your insurance and what options you have. So it's not always easy to choose private health insurance in the first place that suits you and your family. And there's lots of options out there. So it's a really good idea to work out exactly what you need. So the first thing to do when choosing the cover is work out what sort of cover you and your family need. Is it singles, couples, or family? Do you already have health insurance and you're looking to review it? And what type of cover do you need? There is hospital insurance only, there is extras covers only, or a combination of hospital and extras. And depending on who you're with, maybe ambulance cover is included in these as well. So it can get really confusing. Now, there's a lot of websites out there that claim to offer fabulous information and compare a lot of the covers, and I will come back to that shortly. The other thing to look at is your budget. So just saying, oh look, I want to cut it, without sitting down and working out a budget can be really difficult. Now, if you're one of the unlucky ones with coronavirus who's lost your income and you now have to rely on Centrelink, this may be one of the areas where you're looking to cut back. So I just want to run through a few more tips. So deciding who needs to be covered in the family is really important to start with. Now, often children can be included for free in some couples. I know when my children both hit 21, my premiums for my husband and I did not change at all. They had to get their own cover, but the premiums don't change for family. So it may be something that you need to look at, whether your kids are included for the same price with what you've got. And working out how much you want to pay and setting a budget may determine what sort of cover you end up with. Now, are you someone who's more likely to need the extras cover, which is things like chiropractic, optical, physiotherapy, glasses? So have a think about the things you regularly use. If your older couples are no longer looking at pregnancy or IVF options, these are things you can obviously go without. Perhaps you don't need a hip replacement if you're in your early 20s. So running through the options of what is important to you is really important at changing the price. Another option or way you can adjust your price is by having a say in what the excess will be. Now, most excesses now are around $750. What that means is, for hospital, if you go in, you will need to pay the first $750 of any surgery or procedure that you may have. So you may go to a doctor, he says, look, I think we should do a colonoscopy. The procedure is a day surgery. The whole lot is going to cost $3,000, including the anaesthetist and being admitted. You will need to pay the first $750. Now, there can be additional charges over and above that the health fund doesn't cover. So worth looking at your gap and any out of pockets. Now, coming back to the comparison websites, there's a few you've probably seen fabulous advertising for. I love the Compare the Market or Compare the Meerkat campaigns. They're really good. And iSelect also is probably a really popular one that you've seen advertising for. Now, definitely get on these sites, have a look, choose the sorts of cover you're after, get some quotes. But just remember that they do not represent every single health fund available. Now, there is one site that actually does that you may not be aware of that is offered by the government, and that is privatehealth.gov.au. So definitely worth having a look at theirs as well. Now, depending on your income, most people choose to take out private health insurance because it means they will avoid paying the Medicare Levy Surcharge. So everybody has to pay the Medicare levy when they earn over a certain amount of money. When you hit a different tier I will have to look that up for you and come back to you in the notes on exactly what that is at the moment. You will also have to pay a surcharge of 1% of your income. So depending on what that 1% is versus the cost of holding private health cover is a really good way of working out whether it's worth it or not for you and your family. Now, reviewing your cover regularly is really important. Checking to see, that you don't have the hip cover if that's not something you need. That if you are in your 30s and 40s, you may be going, look, there has been coronaries in the family now. Maybe we need to ensure that we have the heart or cancer cover. So making sure you review regularly is really important. Now, I know my personal health insurance decided with the coronavirus it would not be increasing the premiums as it was going to on the 1st of April, which, look, it was only $4 a week, but that's $200 a year that now is in my pocket until they choose to put it up again anyway. So it's definitely a good time to review and work out whether you can cut back, increase an excess, or change cover. Now look, if you do choose to increase your excess, it does mean that you have to find that $750, $1,000 or more when or if you need surgery. So it's always good to have that as a buffer somewhere, whether that's in an offset account against your mortgage, in a backup or buffer account or emergency rainy day fund, whatever you call it. It's good to have that money sitting there for if it is ever needed, and it may mean that you can take a cut in premiums. So look, I hope those few tips have been helpful in trying to decide whether you should keep cover or not. Working out your family budget is really important, and I will come back with another video on that shortly. Thank you so much for considering, and I hope this was helpful.